ATP this way. They start making ATP the wrong way. So if you make ATP the right way, here's a cell. Here's mitochondria in that cell. Here's oxygen. Here's glucose. ATP. 36 ATPs for every molecule of oxygen and glucose. That's how it's supposed to work. So if this is a muscle cell, it can keep working because it's got enough ATP to keep going. If you push too hard, pretty soon it can't get enough oxygen. It starts to use glucose only. No oxygen, and the waste product for this is carbon dioxide and water. That's why we breathe out. That's where the carbon dioxide comes from. You take oxygen in, you make energy, and then when this cell is done making energy, it's got left over these two things. And so carbon dioxide has to get out, so it goes from the cell to the blood, from the blood to the lungs. You breathe out, it's carbon dioxide. You breathe in, more oxygen, oxygen goes over to here, and that's how that cycle works. Now, when this thing is working so hard that it can't get enough oxygen, and it's only using glucose, guess how many ATPs it makes? About 2. Instead of 36. You can't do much work on 2. What happens to that muscle? Starts to burn, starts to hurt, have to slow down, get out of breath. Why are you out of breath? Because it's trying to get more oxygen in to get the thing there. And if it can't, that's why you're breathing so fast. Like, cells like, I need more. And there's not enough. And the other, this, lactic acid. When you have somebody who has this going on, see, sometimes this is just done by exercise. Sometimes this is done because there's a toxin that blocks this process. Mercury is a toxin that blocks the process. So is lead. So is cadmium. So are PCBs. So are certain viruses. When this goes on in a cell too long, or in certain cells, so that those cells become anaerobic, sometimes the cell makes a decision inside, and it says, you guys haven't been treating me right. I'm going to do my own thing. I'm going to continue to make energy this way, but I don't care if you like me or not. And what do we call that cell? That's what cancer is. Cancer is an anaerobic cell that can't use oxygen, that has been damaged by a toxin or a chemical or certain psychological stresses, that this is broken and it's doing this. If you force oxygen into here, you can sometimes turn the cell back around. So ozone is good for cancer too. And the other thing I haven't said anything about before is that, and I just want to mention, and then I'll take questions. If you take water and you put an electrode in here that's got a positive charge, and another electrode in here that's got a negative charge, you can get the H's to go over here, because they have a plus charge, and you can get the O minuses to go over here, and you can collect these O minuses. And you can, O2 is a gas. O16 is a liquid. So if you get them to pair 16 in a cluster, or 32 in a cluster, or 64 in a cluster, it's not air anymore, it's liquid oxygen. So we have gotten from Hungary, the medical doctor that developed this process, has developed a water called Cocoon, K-A-Q-U-N. Now, Cocoon in Hungarian means cocoon. How many saw the movie? Yeah. Okay? So the movie, old folks home, they got a pool, the aliens come from outer space because they've left some of their guys down here. They have to get them going. They have this special water. You go in the water, you get revolved, you live forever, and you go back to their planet. And at the old folks' home, and I think it was St. Pete Beach where the thing was filmed, is these old folks are in the home and they see the pool and they jump in and they start getting younger and and so he decided to call it Cocoon. He said the only problem with calling it Cocoon is in Hungary nobody's seen the movie. So it takes them a half an hour to explain why it's called that so that they understand it. Anyway, we now have a water which is very, very oxygen rich. And if you drink it, your oxygen goes up. So, I put an oxygen sensor on my skin. I'm sitting in a hotel room. It reads normal oxygen tissue tension while I'm sitting there. It's like 64 millimeters of pressure of oxygen. And I drink 6 ounces of Cocoon water. And within about 5 minutes, my tissue level of oxygen goes up about 15%. So my body now is saturated with oxygen by drinking a specialized water. So in all these chronic conditions, there's large areas of the body where they're anaerobic and they need oxygen. And they found that if you give anaerobic cells Cocoon water, they start to utilize oxygen again, and they sort of turn back. So I use it for athletic training and for racing because I can get free more, all the dopers, the cyclists and the guys that are doping are trying to get more red blood cells so they can carry more oxygen in their muscles. Why not drink the oxygen and you can carry the oxygen in your muscles and it lasts about 2 hours? So this is a part of the same thing. So I'm just going to summarize. Lyme disease is around, and if you have a chronic condition, every person that I see who comes in with any kind of chronic problem, I test them for Lyme disease. Because a lot of times I am surprised that there it is. That's the underlying problem with their fatigue or their headaches or their neuralgias or their whatever they got going on. Okay? And if we know that, we can treat it and we can make them better. And that usually a combination of rehabilitating all the natural body processes, levels of vitamins, minerals, teeth, all this stuff, and then some other things utilizing ozone and silver and herbs that most people within a couple month period of time will definitely feel the difference and start to feel better. And that is a better, that they're actually really better. It isn't sort of a masked state that they're having. Okay? So I think we have about 10 more minutes. I'll take questions. And yeah.
2 questions. Do you cure it? Like, you actually eliminate the virus from the system? And then preventative, I have an 8-year-old daughter, almost sure she had the same, tick tested positive, 6 weeks later, no bullseye rash, with joint problems. Took her to a doctor similar to yourself, and he's like, I'm not going to kill her with a whole bunch of antibiotics. The blood test came back negative.
The which came back negative?
The blood test came back negative.
Yeah.
There's no symptoms, but there's a good, from what I hear, is it hides in the body. There's a good chance that this will show up later in life.
Right.
So are you curing it? Are you getting rid of it? And then, what do you do if you think you have it? I mean, and I already know about paleo. She doesn't completely follow that. She's got 2 minor cavities, we take minerals. I'm familiar with leaky gut because of myself. So there's a lot of things I'm already doing, but are there other things that you would recommend preventatively?
Well, I think if you've been infected with Lyme disease, then it's sort of a sitting around, and it could turn on or it could not turn on. But that if we find it diagnostically, our goal is to eliminate it.
But would you? She's showing no symptoms now. She's 8. So would you do anything about
Well, I'd look her, if I really thought that she had been infected, I would look her over carefully, and if I found something that in one of these areas, whether it's her gut or her food or these things, is to put the correction in on those areas. You know, what I'm doing you know, I would be basically doing the same thing with someone like that as someone who came in and said, look, I'm 60 and I want to feel 40 and I want to live 40 more years, what would you do with me? And I would do the same thing. I would check them for all the same things.
She's 8, so I don't want to submit her.
I'd do the same. If this was a worry, I would look. You know, I would look and see what is going on in her system. What does her blood look like? This girl's, this.
I actually know you're like.
Do you have a dark field microscope?
Yeah.
You do it, Ed Lifer?
Yeah.
So you do.
We look. I look at everybody. So if you see this, you say, okay, she's asymptomatic.
But is that blood test the same blood test this was a nice blood test that was done 3 years ago. I mean, this wasn't your simple.
The LabCorp standard Western blot is worthless
It
almost.
wasn't the LabCorp. I
There's-
don't have a reading of it right now, but I mean, it wasn't your standard. Yes.
There's Identics, there's Fry, there's some labs that are doing these that are better.
Yes.
They're not perfect, but at least they're looking under the microscope, they're doing specific stains.
Is this blood test different than the Identics?
This is just a dark field. But the Fry test is different than the Identics. It's different. They look at a slide, they stain it, they're looking for organisms. So if you see a lot of organisms, then I would go after it.
Maybe like the Lyme is a clinical diagnosis, maybe? That's,
Yeah.
so that means like, clinical means like, are there symptoms? Right? Does she need, right? I mean, what's the difference between, maybe you can explain the difference between clinical diagnosis and.
Well, if the clinical problem is there and the laboratory doesn't agree, then I've got to find out where is the discrepancy, what is actually wrong. Yeah.
My husband got really bad Bell's palsy almost a year and a half ago. It's only resolved about 60%. Now, he doesn't go out in the woods, so I mean, the tip is so unlikely, it's unthinkable, but we are in Florida, as we said.
I think most of it is non-tick.
You're talking about mosquitoes and so on.
Yeah, there's plenty of mosquitoes around here.
Not in December.
See, if you have Lyme and the mosquito bites you and it gets infected, why can't it bite somebody else?
Right, but in winter, are mosquitoes around in winter? Is that something you check?
At my house there are.
So I should have them tested for Lyme.
I look because you don't know. Usually it's just passed off. Yeah.
I'm Mackenzie Lemper, your daughter over here, and correct me if I'm wrong, but in the event she were to bring her doctor in for an appointment with you, couldn't you not just look at the child's blood right there in your office during the appointment and be able to tell things just in your office looking under your microscope?
Exactly. We would just check things out and see, does it look like anything's actually going on or not?
Is it pinprick or is it draw?
It's pinprick.
Oh. There we go.
And it's so,
Are you curious?
my technician is so good that they don't even feel it.
Are you curing it? Are you curing Lyme disease? Can you use that word?
Show me a cure. It's against the law to cure.
Okay.
So no. Can the person live a full life and feel good? That's the goal.
Okay. But you haven't seen it eliminated or eradicated from the body?
Well, I see normal blood. The antibodies persist for a long time. The person tells me that they don't hurt anymore, that their energy's back and they feel good. So I'm happy. Yeah.
How long have you been treating Lyme?
Probably since 1997.
After the person gets their treatments and starts to feel better, do they continue with their treatments or do they stop?
Well, that's what you have to see. Is what is it going to take to keep them at that level? I mean, for a lot of people, they do the thing, and then whatever the regimen they need is way less. Can they go back to McDonald's? No. Can they drink every weekend and smoke dope? No. Because if the terrain isn't good, you're going to get sick. If the terrain is good, you're going to stay healthy. And so there's just sort of no free lunch. You know, I don't know if you've heard this. The king is looking for the words of wisdom that is the answer of all answers to anything that could ever be asked. And he sent his messengers out, and they looked and they looked and they looked, and they came back with all this stuff. And he said, no, that's not it, and they had them all killed. And then he sent a whole bunch more out, and finally, to make the long story short, is one messenger came back, and he says, I think I've got the answer. And he said, the king said, well, what was the answer? And he said, the answer is, there's no free lunch. There's no free lunch in anything. Okay? And there's no free lunch in health. Either you do the things that the body evolutionarily needs to function well, or you don't. And if you do it, some people can get away with more because genetically they're stronger, and some people are very delicate and they can't do it at all. But there's no free lunch, and you just have to find what that happy medium is for you. That feeling healthy is as wonderful as a donut, and then you can live here. And the trouble right now with our society is that the toxicity level that we all are all in is enormous. It's just enormous. If you take some nice, beautiful, organic broccoli or onions grown in pristine soil, and it's organic, and you put it in a little steamer, and you steam it a little bit, and you stick a mercury vapor meter just underneath the lid, and you measure the mercury vapor level that is coming off. This is metallic mercury coming off that broccoli. It will be beyond the EPA's level of a toxic waste dump. Okay? Our food is contaminated. Now, if you eat contaminated, terrible food, it's worse than eating contaminated organic food. But believe me, you can't escape it. You can't escape the toxin load. And so the body is living in this. And if you eat right and, shop here and take your vitamins and go to the bathroom every day and get enough sleep and get rid of the people in your life that make you feel bad, you can get along and do ozone treatments. That's what I do. Do ozone treatments. You can get along and you can have fun and you can have your body work well and not get some dreaded thing. But if you don't, it's tough. When I was in college, my wife and I went to this lecture, and it was one of these 80-year-old Indian guys who was he was about this big around, but he was a wise man, and he had us doing yoga all day, and we were exhausted. And the thing lasted like 5 days. So at night he'd give us a lecture, and we were always so exhausted we'd fall asleep, sitting on the floor, and the legs are killing us. And he told me one thing that was good wisdom for me. And he said, look, for the first 20 years of your life, you can do anything you want. For the next 20 years of your life, you can live on grace. And for the next 20 years of your life, your body will take you to hell. And if you watch it used to be true. Now, you've got the first 20 years, you can't even do that. Because the levels of ADD, autism, criminality, all this stuff, you're seeing diabetes, premature cardiovascular disease. You're seeing it in 8 and 10-year-olds, 11-year-olds. They're toxic. Their mothers are toxic. They deliver toxic babies, and they have almost no leeway. So that's the situation that we're in. And what we're trying to do at the clinic is, for you, how can we maximize it so you do the best, feel the best, live the longest with the least problems? Because here's the other sort of sad thing, and I'll just end with this, is that if you get into the clutches of standard medicine, you will definitely die in more pain and faster. Because none of the treatments, except for emergencies, are going to help you at all. They're going to all add to your toxic load. Antibiotics could be curative, like in an early Lyme. But in late Lyme, they're not. And they kill your mitochondria and they mess you up. And blood pressure medicine and cholesterol medicine and diabetes medicine kill you faster. It's proven, it's known. And so if you let it slide to the point where now you're in an emergency situation, your blood pressure is 200 over 150, and you've got to do something because you'll blow out a gasket somewhere. That's too late. Okay? What you want to do is now is get organized, get your habits right, because when you get to them, they're going to start stacking up things which are actually harmful, and they'll do you in faster. And so I think that's what, so our goal is, if a person got there, is how fast can we unwind it? I had a lady last year who came in with 12 medicines. She was 84 years old. And in 3 months, she was off all of them. She had a big grid of 12 medicines, how often she took them, everything. And then she would come in a month and she said, I'm off these 4. I don't need them anymore. Okay? And then she came in a month later, I'm off these 4. And then by the end, she said, I'm off these 4. And I said to her, she says, I feel a little bit better, but wasn't I supposed to feel wonderful? I said, well, you're off 12 medicines. And it's been 3 months. And you're doing better. She said, oh, I guess so. Okay? So I'm going to end it off here. I want to just remind you, Tamara is in the back. If you want to make an appointment, do it. You have these forms, so if you enjoyed this lecture, please give me good marks, and then I'll invite you back.
The newsletter.
Sign up for the newsletter. The newsletter comes every week. I do my best to put interesting things that will help you. If you don't like it, you can cancel. It's free. And have a good evening, and thank you for coming, and I hope this was beneficial for you.